be there in Atlanta. I also wanted to tell you all, as part of a disclaimer, this is not about the appropriate use of opioids. There are appropriate uses that we all know about, and it's heartbreaking for those who are having end of life, whether it's cancer care, or a friend of mine right now is undergoing back surgery, and my last words to her yesterday were, don't take more than 3 days of the opioids. But there are occasions that all of us may need them, and that physicians may need to subscribe them. So that's not about that. Also, I just noticed on your television here last night that they are having a special, The Other Side of Opioids, which will be a special on here in Little Rock. So everywhere I go, everywhere I speak, it's either the front page or it's on the news. So it's something that obviously touches all of us. And finally, I hope that you all will take this information home, wherever you are, at whatever level court, because that is the whole purpose of why we created the National Task Force on Opioids, and why SJI, who I really want to thank for funding us. And as we do end our funding, I'm so hopeful that we will be able to leave you all with a lot of resources that you can continue to push out into the world. So with that said, let's get started. So why do you care? Why do you, as a court administrator, care about this? And so one of the things that we have to talk about is, how is this impacting our budgets? The budgets that we have for our states, our counties, municipalities, and then of course our entire country. This is now what the crisis is costing us. And as we all know, this is not just a healthcare problem, although that's how we've always tended to look at the opioid epidemic. This is also lost productivity, workforce, labor. I have CEOs walk up to me at presentations all the time and say, did you realize I can't even hire half of the people that I either want to offer a job to or that I have a job for? So it is rampant across all these various industry sectors. Then, of course, deaths. And this is what really became apparent to all of us just a few years ago, and that is just how many people are dying. Chief Justice Rush, who's my co-chairman of the National Task Force, often starts by saying, a reporter will say, why is this any different from any other drug issue that our country has ever faced? And she just says, because this many people are dying every single day. One of my friends is the commissioner in Tennessee of substance abuse. She gets up and looks at her watch every time she does a presentation and says, by now 2 Tennesseans will have died, and by the time we go to bed tonight, 2 more. So we're almost at 5 per day. Again, this is what we see the projections of the cost will be, and so we're already at the $1 trillion mark now. Look how quickly that went up. And so if we don't do something, we're going to have another hockey stick like that in the next 2 years. This is a way that I try to show people, what does that number of people look like? And so this is a park that shows almost the exact number of people who have died. So when you look at where all the consumption is going on, just take a look at that, 10 kilograms, all the way up to the United Kingdom with 200 kilograms. Anybody know who consumes more than anybody else? Absolutely, our country. Anybody want to guess? If the UK is 200 kilograms, what do you think? We're multiple times the size of the UK. Anybody want to venture a guess? 600? Anybody else? Up? Pick a number up from there. Almost 80,000 kilograms, 99% of the entire nation. I mean, the entire world population. So again, not merely a healthcare problem, and this is really how the National Center and SJI, how we all got involved in this, was because we started realizing people weren't really noticing what the impact was on the court system. We were all noticing, but nobody kind of outside of the judicial branch was noticing. So we decided that we had to do a better job about telling our story. So again, I just heard a couple of you all are in juvenile court or foster care. Who's in that arena that's seeing this? So are you seeing rising numbers in foster care? You have any idea how much you're up, or?
No, it fluctuates anyway, but I know the judges in our state are struggling with how to match the drug addiction cycle for opioids with the foster care timeline.
So interesting. Tennessee is only up 10%. And honestly, I think that's extremely low. There are states around us that are at 50% increase to foster care. And so as you all know, that is just, where are the foster care parents coming from? You know, what are we going to do about that particular crisis? I don't know how many of you all, I've had so many chancellors call me and say, Debbie, I've got to learn about this. I didn't go to med school. I don't know anything about drug addiction. And so we have actually started training every single judge from every single level. So whether it's staff in the juvenile court judges, civil, chancery, appellate, and even our Supreme Court. And so those are some of the materials that I'm going to show you all. If you all are interested in curriculum or videos, we can also provide that to you all, almost a toolkit, so you can just walk in and say, we're going to have a 3-hour module to train our judges, which I really encourage you all to do. So again, guardianship and conservatorships are beginning to go up. Either grandparents are coming in to take over their adult children's assets or become the conservators, obviously, and foster parents for the grandchildren. But there are just so many ways that the courts are being impacted. And so one of the first things that Chief Justice Rush and I did was go to Washington to try to talk to people. This is not just a federal court program. You all might remember we were so excited. President Trump set up an opioid task force. Chris Christie, who had been the governor of New Jersey, obviously, was chairing that. We were so excited. We cheered it on. We had press statements about it. And when it came out, the only courts that were discussed were federal courts. So sadly, we had been totally left out when we all know 95% of the caseload is in state court. So we felt like we had to go and start being the advocates to say this isn't just in federal court. We want them to prosecute those kingpins, right? We want them to take down some of the cartels, but we have got to deal with all of these issues. Again, here's Chief Justice Rush, and here are also the Chief Justices. I don't know, is anybody here from Iowa, New Mexico, or Vermont? 3 of my favorite Chief Justices in the world. They have done yeoman's work. Chief Justice Nakamura is trying just to even keep her own budget, and yet she is working on these issues all the time, which we really appreciate. And then Marcia Meese, Nancy Dixon, and Corey Steele. I thought Corey was here. Marty, do you know if Corey's at NACM? Anyway, so excited. They likewise are the director of their courts and are doing just a tremendous job. Chief Justice Rush, talk about somebody who walks the walk and not just talks the talk, had a summit. Over 1,000 people were there from every single county in Indiana. And it wasn't just a judge or the judge's staff. It was somebody from mental health, substance abuse, sheriffs. I met people from all over Indiana. And so I would really, really ask and encourage you all, if your governor hasn't done this or your legislature, step up and do this as the judiciary. Again, here's our whole task force, just so excited that so many of these people are giving so much of their time. So what were some of the goals and solutions that we started with? As I said, we really wanted to start coordinating. The NGA and NAG, the National Attorney Generals, were two of the first groups that we reached out to, mainly because they had been working on the opioid initiative with their national associations since 2012. If you all haven't seen the NGA's report, it has every single state and what those initiatives are doing. I'm sure those are going to be updated because if your state is like Tennessee, we have a brand new governor, and I'm sure that he is going to be wanting to put his stamp on our initiative in Tennessee as well. So I really encourage you to take a look at those. But what we did was try to take those and then say, what can we do that is like this for the court system, for every level of court? And then the next thing that happened was we created this regional multitask task force that is now up to 8 states. I believe that there is also one that is starting up in the northeastern region. So again, many of the reasons that these states got together had to do with the foster care problem and moving kids across state lines. Tennessee is surrounded by more states, I think, than any other state. So somebody at the north of Tennessee is trying to have their child go to grandma in Kentucky. And so the judges were very, very frustrated at the whole ICPC, the compact that moves children across state lines. So that's one of the things that we've been working on as well. Medicaid and insurance coverage. I've pulled together and have requested that we have a justice liaison. Many of your states may have one of those with the Medicaid office so that we can cut through some of the red tape. Bench cards, toolkits, judicial training, all of these things we started out with. What are our goals? Because we had a short period of time and we needed to be very fiscally conservative with SJI's funding. So I'll go into more about what those deliverables are. This was one of the Children's and Families Work Group. It's one that you all might be especially interested in if you are involved with those issues. And of course, then here's the membership that some of you all may know. Judge Tepper in Florida has been incredibly involved, and just appreciate everyone's time and efforts. They have conference calls at least once a month. Sometimes they're once a week. And so these people are giving an incredible amount of time. This is Civil and Justice Work Group. Nancy Dixon, who is, anybody here from Kansas? Appreciate so much her taking this leadership on. And then the third one was collaboration and education, because we just felt like we really needed more collaboration with all of our partners throughout both our state systems, but also the larger national ones. Chief Justice had an article in Law 360. If you all haven't seen this, it's a really great overview article. She may be one of the very few Chief Justices who started out as a juvenile judge. So this means so much to her, and she is so committed to this. I really encourage you all to get the article. I print it out lots of times when I'm going to speak, like to a civic group or to a group of judges, and just provide it to people because it's a great, it kind of goes through the history of the opioid epidemic. Then, this is why, Paul, thank you for having me. This is our new website. And from the very beginning, we wanted to make sure that people were going to have whatever they might need, and that you all would not have to go out and recreate what we have already pulled together. And so right up here, you can see there is a direct link, Resource Center for Courts. And I have these handouts for you all to take with you. They will be posted online with my presentation as well. We also do an excellent job with funding opportunities. So as you all may know, that is as varied as SAMHSA and HHS to USDA. They have hundreds of millions of dollars specifically dedicated to the opioid crisis. So we are trying to keep a ready list for you all to go in and check if there's introduce anything new. The other thing that we have that I wanted to call your attention to is down here in the news. And we amass all of the news stories from across the country in one location. One, you can see, are there great ideas going on? Is there a pilot project that you might want to emulate? As well as just how horrific the problem continues to be and grow. Again, once you go on the Resource Center, then you all will be able to choose what you want to take a look at. Each time there's a new one, it will be right here on the front of the page. This one I was just telling Paul about is actually fentanyl and their analogs in the courthouse. What I did was I took this safe handling of fentanyl, and I'm going to make that available as well, and I laminated it and sent it out to every courthouse, every court clerk in our whole state, because people were starting to see fentanyl in the courthouses. Anybody from Massachusetts? I think you all have actually banned fentanyl from all the courthouses. And so, did you all adopt special rules about exhibits?
Not that I'm aware of, but I know that that's been, I know that that's been an issue that we're addressing. And one of the issues that we have is, of course, the guardianship uptick. And we have a probate and family court that deals with those issues, not a juvenile court. So we have some challenges in that regard relative to certain grants and things of that nature. But
Right.
yes, from Massachusetts.
So one of the things that we may do is try to get some examples of what the special rules that may go into effect for some courts, some courtrooms, and some courthouses. But after you start to see people actually overdose in court, you realize how dangerous these drugs are. Again, this is kind of at the very beginning. We wanted to set forth principles that we really stayed attuned to. One, we knew that we couldn't just go off on all kinds of, chases trying to tackle problems that really weren't within our wheelhouse. And Chief Justice Rush has done a great job. So we decided that we needed to have these principles to start out with and to try to stay true to that fidelity. This is one of the ones that I think many of you all might want to see. Again, some of these are very broad and educational, and some of these are very how-to or get you to some more resources. This one is trauma, substance abuse, and justice system involved youth. So obviously we wanted to get into the whole discussion of ACEs because we didn't want to put materials out there without having people recognize that yes, we indeed know about ACEs. And so I think that I have some copies of this, but again, all of this is available. Again, if you all wanted to, I know that if I go out and speak to CASAs, I will take materials like this with me so that they can also be, again, pushing this farther and farther out for people who are dealing with them. Back to fentanyl, this is how quickly the fentanyl spike has gone up. That's really all I'll say about that. But just as an introduction, this is how much fentanyl can kill you, can kill someone. It's just absolutely unbelievable. Now, back to my original disclaimer, I mean, there are appropriate uses for fentanyl. And actually the USDA, has already approved an even stronger medication than fentanyl. And so there are uses in the hospital, again, with oversight by a specialized physician. But it just gives you some idea. Our special agent, that we also have videos, for instance, if you all wanted to use our agent to talk about various types of drugs, you're welcome to. Or I would suggest that what you do is invite somebody from your Bureau of Investigation or a sheriff to come in and do the special drug curriculum. But what he does is bring a packet of sugar and walk around and just show the judges how few grains it would take for somebody to OD. And then this is one of the big overviews, just understanding the basics of addiction. So when we started out, there were many judges who really had not been prepared. I mean, very few judges have ever had any kind of medical training or substance abuse training if they aren't a direct recovery or drug court judge. So we wanted all of our judges to have some basic information, and again, just helps with the public as well. These, again, involuntary commitment, and what we do is to provide a list of each state. So again, we're trying to take into consideration that everyone has different state laws on these issues, but we also wanted to put that all in one place. Maybe you want to have a discussion with your legislators. Maybe your legislators are calling you and saying, hey, Debbie, what do we need to do this session? Which ours are. We have numerous bills that are up in our legislature right now, trying to change some of our laws to make sure that we are getting people the right services in the right place. Again, treatment of opioid use disorder. Many of your judges may be senior judges who don't really appreciate trading a drug for another drug. So one of the things that we have really tried to work on is medically assisted treatment. What is that? What are the best practices? And to make them feel comfortable with the options that are available. Another thing that we've set up are some webinars. Have any of you all worked with your PDMPs? These are the prescription monitoring programs in your states. So drug and recovery court judges in most every state have access to the PDMPs. It's helpful to know if people are out and they have been buying, for instance, from multiple pharmacies in your state, or even, again, that's why we created this regional task force to see if they were going over the line into Kentucky to buy from a pharmacy there in addition to the pharmacies in Tennessee. Unfortunately, Tennessee has not embraced this as much as some states. In Indiana, you can actually go on and there is a dashboard. All of the various health-serving agencies have executed MOUs, and so they are sharing a lot of information. So whether it is the worker from child support, HHS, or whether it is someone who's working with foster care children, or whether it is the judge sitting there, all of us want to be able to make the best judgment about the person in front of us. So again, encourage you, if your state has not opened up their PDMPs, and if your judges are interested in getting this information, then I hope that you all will go on there. We have nothing to do with this, but Brandeis University actually has an information number. So if any of your judges or courts are interested in more information, please use this. Again, it just gives you more information, and specifically by state, so you can go in and find out exactly what the rules and regulations are. In Tennessee, and this may be the case in your state, it's governed by our Department of Health and specifically the Board of Pharmacy. So in many states, who is the people who have the keys to the castle, if you will, and so that's probably where you need to start. Again, there are many areas of our nation that have already dealt with MOUs and trying to share court resources. And the tribal nations and those state courts have done an incredible job, and they can serve as a template for other courts and other jurisdictions. So even if you don't have a tribal land in your state, the MOUs and the agreements that they have already been doing for years, so that people who need a drug court could go to a specialist at a state court judge if they don't already have those resources with the tribal nations. So again, this is both information if you're in those states, and it's also a template if you're in another state but you would like to share resources. Again, this is just another collaboration that we wanted to focus on, give you another example of what we've done with the tribal nations. And then this is actually one of those sample agreements that I was telling you about. So the other thing that we've tried to do is give you real resources that are actually tools that you can just lift and use. Again, more about child welfare systems and just the whole discussion about prevention. I know that many of you all, or your judges, or the staff who work in juvenile courts know that Families First has a historic new piece of legislation. I'm very proud of the fact that my senator, Senator Alexander, is chairman of the Help Committee for the United States Senate, and he was really instrumental in getting this through. For the first time ever now, instead of having to place a child into foster care or custody in order to get resources and funding, now there is the ability to access Families First funding on the front end to prevent them from going into custody. And so again, this is just providing some more information about that. This is a video that you all may want to get. I'm not going to play it, but this is something, again, that is just a tool on the website for you all to be able to use, whether you are speaking, if you're doing a training for staff, if your judges would like to have a module at their judicial conferences. These are special courts that we have found across the country that we wanted to showcase. Again, trying to give you real-world ideas where something is already up and running and being very successful. In Buffalo, this particular judge has been speaking all over the country where they triage people immediately when they come in, and they immediately, and I'm talking about walking down the hall, getting an assessment, and walking into a treatment room. And then he actually sees these people almost every day for the first 30 days. So you can imagine what that's like, knowing that. So he has really committed, and talk about taking a lot of personal time. So he has done a really wonderful job. This is the Opioid Summit that I mentioned. If any of you all are interested, we can get you all the information about how that was organized. Kentucky START teams are another really great pilot project. All of these you can go online and find on the website. Montana is really using, and I see the lady from Cisco here, they are using Polycom and all these free services that are out there. And I saw a video that showed some of the farmers out in Montana. I mean, you just see nothing for miles and miles, and then you see mountains, and the farmers are on top of their trucks doing yoga with a yoga instructor, because that's part of their sobriety. So they stop the truck wherever they are, they tune in, and it's just such a wonderful example of using all this new technology that is out there, much of which is free. And then, of course, very proud of Tennessee. We have a judge who's invented a new recovery docket. He has been a recovery and drug judge, but what he has decided is to take a streamlined module to teach every judge. How could you, without going through all of the certification to be a recovery court judge, but how could you glean the principles and try to inculcate those into what you do every day? So I'm very proud of that. Again, so appreciative to SJI. In addition to the original grant that helped set up the task force so we could get all these resources to you all, they have also extended a new grant to do some pilots that would specifically assist children. So that will be coming out in the next couple of months, and very excited about that. And then obviously what we also want to be able to do is track this information so we can say these are best practices that do indeed work for our children. I'm leaving here to go to the National Legal Services Corporation Task Force meeting where I will be hoping that they are going to take this back to all of their medical legal partnerships as well. And you all may be familiar with the fact that they have been setting up these partnerships for the past couple of years. We are so excited because they are now seeing how the partnerships that they established now have a real purpose in the whole opioid epidemic. Because as you all know, somebody may walk in with a criminal charge and they also have an eviction notice and they also are losing their insurance and they have all other kinds of civil type issues where there are no indigent counsel for them. And so this is going to be a way again that we hope we can push more of the information and resources out farther into communities all across our country. They are also very focused on all of these issues that are beyond just the legal issues. So we want to try to help solve their legal issues. That's what they're kind of coming in the door for. But we also want to try to connect them with all of these other kind of extra legal issues that they're facing as well, because they're not going to be successful on the legal side and keep their sobriety if we also aren't talking with them about the social services that they need. Again, here are just some more contact information, and they have this bill that you all might be interested in as well for your state. Here were the 9 states now that have joined the regional judicial opioid initiative, and as I said, much of what they are concentrating on specifically, and their curriculum will be out soon as well. How am I doing on time? Anybody keeping time? Okay. I'm very proud of the fact that we decided in Tennessee we really needed to establish our own. Our governor has an initiative, but as I said, our governor retired, and we have a brand new governor. So we wanted to make sure that we were keeping a focus on all these issues as they began to get up and running, appoint their cabinet officials and all that kind of stuff. And we wanted to specifically stay focused on the issues we're worried about: foster care, the PDMP access, being able to move children as quickly as possible across state lines that might not be at the top of every one of the cabinet members. Here are some examples, and really the only reason this is up here is just to give you examples of, if you all were going to establish one in your states, the types of people and the representatives that you all might want to include. Again, how we are trying to also be advocates for what some of the needs that we're seeing. So right now we know that there are at least 150 women that need to be in some kind of residential treatment center. There are very few of those in Tennessee. I actually know that in Nashville there's 67 women sitting in jail whose husbands or male co-conspirators are already out of jail, all the same offenses, but they're in jail because there's no place for them to go. So it's something that I personally am very, very much working on. Just the dollars a day from 76 down to 56, it seems like a no-brainer. Trying to tell our legislature, you are already spending this amount of money, and we're not solving the problem. People are just sitting in jail with no services. So we are very much involved in this discussion, and we're hoping again that our new governor is going to include some money and possibly reopen what was an old mental health facility to serve in this way for women. I am very concerned, and we're going to talk about this, about specifically pregnant women, so that we can get them off drugs and have some kind of therapy sooner, because what that means is then they have a better chance of having a healthy weight baby and a healthy baby rather than an NAS baby. So again, these are just a few of the places that these three the recovery cabin that actually one of our judges helped to create, and Renewal House do indeed have pregnant moms there. And the recovery cabin has had every single baby born. I think they're up to 39 or 40 healthy. So not only is that a vast savings, not only does that keep that baby out of foster care, but it also is the greatest incentive for a mom to stay clean. So this is how much that it is costing. Every 25 minutes a baby is born, and I wanted to show you all a very quick video. Again, you all are welcome to use any of this. We won't watch
A quiet epidemic on the rise where roughly one baby an hour in this country is born hooked on prescription painkillers their mothers are abusing. These innocent victims face an uphill battle, as we saw when we were invited into one special hospital ward in Tennessee. ABC's Juju Chang brings us a quiet epidemic on the rise where roughly one baby an hour in this country is born hooked on prescription painkillers their mothers are abusing. These innocent victims face an uphill battle, as we saw when we were invited into one special hospital ward in Tennessee. ABC's Juju Chang brings us this tale of hope and heartbreak as part of our division-wide commitment to telling the stories of the invisible among us, a hidden America.
It's noon in the neonatal intensive care unit at East Tennessee Children's Hospital, and baby Grayson, just 48 hours old, is shaking again.
He's tremoring in it.
Grayson was born with a serious drug dependency because his pregnant mother was addicted to painkillers. Now he gets morphine every 3 hours to cut the pain of withdrawal. Grayson was brought here from a nearby hospital to this special unit for detoxing newborns. Right now, there are 23 tiny patients here going through withdrawal, mostly from prescription pills like OxyContin, Vicodin, or Percocet.
It's just hard. I mean, none of it was planned, you know? I wanted something better for him because, I mean, I grew up around it, I know. And it wasn't fun. I didn't want that for him. I wanted better for him because I wanted to be the mom that I didn't have.
A quiet epidemic on the rise where roughly one baby an hour in this country is born hooked on prescription painkillers their mothers are abusing. These innocent victims face an uphill battle, as we saw when we were invited into one special hospital ward in Tennessee.
Incredible Judge Sloan, the one that I told you, has been creating this new 10 rocks for our judges, and he has the babies up on his bench as he talks to the mom every time that she comes back again. Here is his 10 rocks docket. We'll have more on that, and some of the moms, this one, as you all see, had twins, healthy twins. Again, one of the things that we're also trying to do, and this has to do with moms as well, is to make sure that they're also healthy. So we have collaborated with our Department of Health. I'm sure that you all would be able to do this as well. They are transported for free. They get a free medical, and as you all see, mental health assessment. Obviously, there's a pregnancy test done to see whether or not they're pregnant and whether or not they're using at the time that they're in front of the judge, which sadly and unfortunately does happen. The other thing that they're shown is a video about the access to long-lasting reversible contraceptives. So all of this is just about trying to keep women healthy, keep them clean and off drugs, and add parenting skills and social supports with the housing that you all saw from that recovery cabin. And this is just incredible. So NAS cases decreased by 52% in 1 year where this collaboration was going on. Again, this is a fact that I never knew until I became more involved with the National Task Force, and that is courts, all of us. It could be court administrators, court clerks, it could be staff to a juvenile judge. We are the largest source of referral for treatment other than self-referral in this country, and yet we were not part of the conversation. And so that's why this is so important for you all to be engaged and to take this information back with you all. I am hoping this might show, but if it doesn't, I will turn it right off. This was when Megyn Kelly was doing the Today Show. Doesn't look like it's going to show. So again, I'll show you Megyn Kelly. She actually came to the cabin in East Tennessee. These are so unwieldy. She came to the cabin in East Tennessee, the cabin that you all saw up there on the PowerPoint slide, interviewed one of the young women, actually two of them, who had been pregnant, and spent, I think the video crew was there for 2 entire days interviewing people. The community wrapped their arms around these people. In fact, one church came and said, "What can we do?" And here's one of the moms sitting on her twin bed in the cabin just saying, "I thought that I would never get another chance." She appeared in front of
Morning, everyone. Good morning and welcome. I'm Megan Kelly. This week, we have been looking at stories of addiction. Today, one that hits home for so many families, and that's addiction to opioids. It's going nuts in this country, isn't it? It's nuts. Raven Mason and Tesla Smith were not just addicted to drugs, they were also pregnant. Thinking no one would ever give them another chance, they found hope in an unlikely source, a tough-as-nails Tennessee judge. Watch.
This was my first bedroom here in the house.
The first time Raven Mason walked into this room, she had nowhere else to go.
I was very broken. I was really scared. I didn't want to be here.
A convicted felon at 19 years old with 3 children and 1 on the way. Meth and pain pills destroyed her life.
I had already lost everything. I lost my house, I lost my car, I lost my job. I had no money. I pretty much had nobody.
I felt like a failure, just like a disgrace, like a waste of space.
Tesla Smith's story is eerily similar.
Everything in my brain would be screaming, you know what'll make you feel better. It was a way for me to escape reality.
She even got high when she was pregnant with her son.
I wasn't even thinking about him at the time. Not only did I fail myself, but I failed him too.
But
with a little baby cap on, and it was so cute, and he said, "Another healthy baby." He goes to the hospital to see the babies. He is just such an incredible mentor for these young people, and like a grandfather. And not only that, but he adopted 2 NAS babies himself. So he's just an incredible person. If you all want him to come speak, I won't let him come because I need him. But we have him on tape for you all. We also have several neurosurgeons and people who are specialists in addiction who are just incredible speakers. Again, I would encourage you all to invite someone from your community to do that for you. But if you don't have someone, or it's going to be very expensive, then we would love for you to use our speakers as well. So with that said, I wish you all could see these moms hugging their babies on the porch of the cabin. It is just so wonderful, and I love to end on it because it is just, we can make a difference. All of us can. And I want to thank you all for taking these materials. Take them home with you. Call me, text me. I've got my cards up here. And the National Task Force just appreciates this opportunity so much to be here. And we want to help you all just keep dealing with this issue that we are all dealing with across the whole country, and one day to solve this issue. So thank you all, and I'm happy to answer any questions. If anybody wants to come see her, here she is. Yeah, she's just really an incredible spokesperson. Raven.
I just had one question.
Yeah.
We've noticed an increase in the number of people being diagnosed with HIV as a result of this epidemic. I'm just curious whether or not other states have seen an uptick in that diagnosis.
We have in Tennessee, and actually much more so in pockets of areas, and I know that some communities are trying to take the needle back. And that's something that I don't think that we had planned to do a fact sheet on, but I think it's something that we might want to share, not to take a position on what to do, but here are some communities and how they're dealing with that. So I know that I feel like police chiefs and sheriffs are probably the ones dealing with those, although it's some of our park commissioners, who are very concerned about what's going on out in parks, where you want families to be, right?
Hi.
Hi.
Thanks so much. That was really wonderful. I'm the person from Cisco she was talking about. But there's so many different ways to approach opioid crisis in different areas, and we're concentrating on one because of, the court and what they can do. But, I just wonder your thoughts on collaborative spaces or how the court reaches outside of its walls, like you were mentioning about the Polycom. And so if the task force has talked about that or thought about how to expand that out and what their needs and what they're looking for or what they're brainstorming around.
So one of the reasons that we're trying to use pilot projects is somebody who has already done that. So the Polycom was just one of those examples. If Cisco has some, we would love to showcase some of those as well. I know that I have been trying to get AT&T and Verizon in Tennessee interested in doing some pilot projects. I was involved with the Mental Health Center for a while, and Verizon had a really great, and many of your courts may be doing the reminders for your court date online or on a text. And this was to remind people, take your medicine. It's raining today, so you might want to touch base with someone. You have an appointment at 2 p.m. And so it was a really great, again, it was a pilot. It was a limited amount of money, but it had really, really great results. And so those are some of the ways that I think, especially in areas that do not have the court texting yet, or any kind of online notification. I think that especially with people who are in recovery, there are supports that can be very helpful in keeping them on track. So whether it's actually getting to court or it's getting the services they need. Actually, I wish I could remember where the courthouse is, but they had some extra space. And just like I was talking about the judge in Buffalo, rather than people having to go on a waiting list, we won't be able to get you an assessment for 2 weeks, and that is at another location. There's actually a courthouse where they have brought in all the providers in the courthouse so that they are able to actually refer people right then. Ms. Tate will take you down the hall and get your assessment done. You might be able to see a counselor, right next to Ms. Tate's office while you're here if you have time to do that. So again, just trying to make it easier for people to get the services that they need. But thank you. And if you all have some examples, please give them to me and we'll post them on the judicial website. Yes?
What are examples of really effective treatment modalities?
Well, I'm not an expert. I'm not an addiction specialist. And so I think that we just look to those people to advise our judges on what those are. And I think that they change. Everyone's brain is so different. When you have these neurosurgeons come in and they show you the splices of the brain and how, especially with the opiates and the drugs that evolve from the opiates, it changes the organic nature of your brain. It just takes a brain on opioids longer to get back to normal than it would a brain on other types of drugs, for instance, even crack cocaine. And so I think, one, the treatment is longer, and then it's also the discussion about medically assisted treatment and what type of drugs might work best for a particular person, whether it's Suboxone or methadone. Callie.
Debbie, if you don't mind, I want to take just a second, since we've got still about 10 minutes or so, John, to follow up on your question. For those of you that are here and engaged, and we really do appreciate it, we're going to continue this discussion at the annual NACM conference in July in Las Vegas. The Opioid Task Force is graciously going to do another workshop for us so that we can continue to give you information and updates on what they're doing. And we're working with the task force to have one of the wonderful national doctors that your task force has been involved with, who's going to do a plenary session on substance abuse and brain development. So to John's question, just stay plugged in with Debbie and the wonderful work that the task force is doing, and with NACM, because we will have more for you in July directly on that topic.
Sure, and thank you. And just to add to that, as we know, we've all been involved in task force in our own state before, and they come out with some great information, great products and resources, and unfortunately, sometimes, that information gets, placed on the shelf. And the work that Debbie and others have done have been so tremendous. It's a challenge for each one of us to now go back to our courts and share this information, not simply just say that there's information on a website, go look at it, but maybe make a recommendation to put it on an agenda for our next judicial conference or our clerk's conference. And again, what they have provided to us is some material that we can take and deliver our own presentation, tailor it to our own states. So a challenge for us is, again, take this information back and make it livable and to carry on, because this crisis is only growing, impacting all of us. And it's not just treatment courts. And I like how Debbie started out, because we started talking about this on an HR level. We have our staff members that are dealing with this, and we don't really know how to deal with it, not just for cases coming before the courts and the increase of foster care or guardianships. We have our coworkers, and many of you have friends and family that are impacted by this. So by taking this information and sharing it and pushing the envelope and say, hey, can you put this on the agenda, or a training program, or a brown bag lunch where you show some of these videos, we need to keep it alive. And as Callie had said, at the upcoming NACM conference, we'll have this, but I was sharing with Debbie this morning, we'll be pushing out a lot of this information through our newsletters and some other email notifications to keep this information alive and push it out. And again, use this information, take it, and push it out in your state. So we would encourage that.
I will say that one of Chief Justice Rush's colleagues, a judge in Indiana, opened her summit by playing a 911 call of a frantic mother calling 911. It was so powerful, I can hardly tell you all about it. And it was the judge and his wife calling about their son who had OD'd. And so he says he will go anywhere. He will send you the tape if you want to open something with that. Often I will just hold up and say, this happens to me all the time. A friend's son or daughter, one of my friend's husbands, I'll be reading the obituary, and this one is just beautiful. He created the most amazingly intricate drawings. Each piece is a gem. He loved the Patriots. After a happy and productive period in recovery, he lost his battle. And it is. Thank you, Paul, for saying that sometimes we get lost in the numbers. I want to show Penlow Park because I want people to see what this is now bigger than almost anything this country has faced. And actually, there is a pandemic summit that is going to be, is it in Nebraska?
It's in May in Nebraska.
And one of the first things that I was writing immediately saying, but this is a pandemic. That's what it is now. We think about pandemics being a flood or a natural disaster, but really that's what we're dealing with. And thank you for bringing up that it is very personal to our employees, to our friends, and our families. My own church has started, like AA, they have a meeting for parents who are going through this, and it's mostly parents with adult children who are either trying to be in recovery or who are relapsing. And I didn't even know that had started, and so I was so proud of my church. I went to speak to a they had all of the church come together to hear about opioids. Our church has now bought Narcan, the recovery drug for overdosing, and so I hope all of your courts and your court clerks have it. I feel like we use them all the time, which is very, very distressing. So, any other questions or comments? I'd love to hear if there's something going on in your state. We want to showcase that. The other thing is I want to make sure everybody got this. It has every one of the deliverables and the webinars, how to get those. Then the other thing that I didn't bring because this is lengthy, but it's very helpful. I carry it around with me. It's a common language glossary. And so again, great for your judges to have. We have bench cards for them. Again, that's exactly what we would like for you all to do. Take my PowerPoints, take out Deborah Taylor Tate, put your name on it, and go forth and do good things. So any other comments from your states? If you hear of anything, please send me or ask one of your judges to send it in to me so that we can post, because this is all about sharing information, because that's the only way that we're ever going to be able to do this community by community. Thank you, and thank you, Paul. Thank you.
Please remember to fill out your evaluations on your app.